Good evening, everyone. My name is Derek Lawson, and I'm a distance education graduate student and a full-time financial planning professional. I traveled here tonight from Kansas City to happily introduce all of you to two amazing individuals that have been very influential to me in my time at Kansas State. That is Drs. Kristy Archuleta and Sonya Britt. Dr. Archuleta's career objective has been and is to bridge financial planning, marriage and family therapy to form a very unique and interesting area called financial therapy, where financial planners and relationship therapists work together to provide comprehensive treatment to clients that are experiencing financial distress. Dr. Archuleta is currently the president of the Financial Therapy Association and is a licensed marriage and family therapist. Dr. Sonya Britt is the program director of the Personal Financial Planning Program here at Kansas State University. She was the founding president of the Financial Therapy Association and has an education in both financial planning and marriage and family therapy. Dr. Britt is known for her groundbreaking research in physiological assessments of stress within the financial planning and counseling settings. As a matter of fact, Dr. Britt and the Financial Therapy Clinic here at K-State University were recently featured in an article by the New York Times. It is because of the work of these two outstanding individuals in the area of financial therapy and thinking outside of the box when it comes to working with clients in a financial planning setting that made me choose Kansas State University to further my education. In fact, I've enjoyed working with them so much and they've been so influential to me that my wife and I will be picking up from Kansas City and moving to Manhattan as I embark on my doctoral program, so that way I can learn from them firsthand. Lastly, as one of the first students in the new financial therapy certificate program, I can say that there is great interest in financial therapy and that the education that it has provided me as a practitioner has provided meaningful solutions for my clients who have exhibited financial distress. This exciting time in financial planning is largely because of both Dr. Archuleta and Dr. Britt, and both of which were pivotal in the creation of the first textbook on financial therapy. So, tonight, it is my honor to introduce you to Dr. Kristy Archuleta and Dr. Sonya Britt.
Thank you very much, Derek, for that very kind introduction. Sonya and I thought we would start out with a little story about a couple that I know, and they fight. They fight all of the time, and they fight about money. They fight about how they're going to spend their money. They fight about how they're going to save their money. They fight about how they're going to reach their financial goals. Heck, they can't even decide on what their financial goals are. So this may sound like somebody that you know, or it might sound like you. Regardless, where does a couple like this go for help? Oops. Is it a marriage issue? Is it a financial issue? Is it a marriage issue? Should they go to a marriage therapist because they're fighting all of the time? Therapists typically, mental health therapists typically are not trained in money issues. They're not trained in personal finance. In fact, many avoid the topic altogether and don't even ask about money, even though it is a common topic all of the time. Financial professionals, should they go to a financial professional? Because they're not trained necessarily in the interpersonal aspects or the intrapersonal aspects of money. I know some financial professionals who'd rather hide underneath their desk than to deal with a client's emotions or a couple fighting in their office, and I literally do know these people.
It is true.
We would argue that it's neither a marriage issue or a financial issue, but it's a both and issue. It's both a marriage issue and a financial issue, and that they need to be treated together.
However, this is not constrained to just couples. In fact, money is probably the #1 stressor among Americans as individuals, and especially for millennials and Gen Xers, they're experiencing extreme levels of stress regarding their money. So it's a problem for couples and individuals. So what Kristy and I did, along with a couple of other professionals, is bring together 30 people around the United States to see if they also saw that maybe this was something that we should try to address professionally. And these 30 people along with us, agreed that yes, this is an issue that's affecting a lot of Americans. And so we formed the Financial Therapy Association shortly after our first meeting in 2009. And shortly after that came the Journal of Financial Therapy, which is edited by our very own Kristy Archuleta. So then we decided with this group of 30 people, we need to figure out what financial therapy actually means. And so we came up with these concepts of defining what financial well-being is as a part of a person's financial therapy health. Some of these aspects are a little bit easier to identify in people than others, such as the behavioral aspect. You can probably identify some compulsive shoppers that you might know. That's pretty easy to physically identify. Other ones are not quite as easy to readily identify in people, such as the cognitive area, where there's research that shows that people who are pathological gamblers, that is triggering the same part of their brain as people who use cocaine. So that's a pretty serious issue that not everyone is equipped to address. There's also the relational issues that Kristy talked about that you would think would be fairly obvious to identify in couples, but I've been in sessions where one partner will decide it's the perfect time to tell their spouse or their partner about this credit card that they have that they failed to mention in previous conversations. 80% of couples actually hide spending from their partner. So this might be you. The way we go about teaching about financial therapy at K-State is really wonderful because we provide experiential training to the students, as you can see here, but we also are able to provide services to the community members, often at no charge, which is great for everyone. The solution-focused financial therapy model is developed by Kristy, and it involves collaboration with financial planners and marriage and family therapy students. And you might have picked up on this, that financial planners are not always willing to address the emotional side of money. And we had one student who was especially critical that he didn't need a therapist helping him with these clients. He didn't see how this was relevant, but he was the very first student who commented that he used this model as soon as he went home to his practice with his very own clients. My specialization within financial therapy, research, and teaching deals with physiological stress and how people react to different types of financial planning environments. The office setting, the different types of news playing on the TV. But surprisingly, one of the things that gets them most stressed is just putting on the physiological stress device. I've had more than one person ask me if I was going to be drawing their blood when I was putting it on. I said, no, the IRB won't allow me to do that. But it's pretty interesting research that was just featured in the New York Times, as Derek mentioned.
So we had a professional association that was designed to help professionals, pioneers really, in this area who needed to network with other people, who wanted to share information, to share practice models, who were trying to figure out how this all works and how it works well. However, how are we going to train new financial therapists? How are we going to train people to integrate financial therapy into their practices? And so there was this big gap because there's no training, there was no education. Besides just a few classes here and there offered at various universities, there's no set of academic curriculum. So last August, we launched our graduate certificate in financial therapy, and to our amazement, we were just expecting a handful of students for the first offering of the course, but we've had 4 times that many students in our classes. So it's been really a very great experience. So the program is really designed to help people understand, to gain the knowledge, to go back into their practices. We have many people who are professionals, mental health professionals, financial professionals who are already out in the field working. So it's designed to help those people go back into their practices and integrate these financial therapy aspects, as well as to help students who are going to be launching their careers in one of these areas or as a financial therapist.
So whether you want to become a financial therapist or maybe you need a financial therapist, there's a pretty good chance you'll know someone who does need a financial therapist. So we included our contact information up here if you want to check out what we do more. Thank you for having us.